afternoon and welcome. My name is Erin McDonough. I'm the hospital's Chief Communication Officer. Thanks for joining us today for this virtual press briefing. We're doing this virtually for obvious reasons to maintain social distance. You'll notice that our panelists are also sitting at a safe social distance. We're trying to be as much as possible role models, so we realize for our media colleagues it's not the ideal shot. It's what we're doing to keep our providers and our leaders safe. The purpose of this briefing is to allow our nursing leadership to respond to the many inquiries we've received about the hospital's preparedness to the response to this pandemic. With us today are Trish Powers, who's the chair of the Massachusetts Nurses Association Brigham and Women's Hospital Bargaining Unit. She's also an operating room nurse. And Dr. Maddie Pearson, who's our Senior Vice President of Clinical Services, our Chief Nurse for Brigham Health, and Dr. Pearson is also serving as the Operations Section Chief for Incident Command during this crisis. Here's how this is going to work. We'll take your questions via webcast, and as you email them in, they'll be sent to my cell phone here so that I can read them out to our two experts. If you're having any technical issues, please email us, and we'll do the best we can to adjust. If you did not let us know that you're participating in today's webcast, please do let us know so that at the end of this we can send you the video as soon as it's available. So I'm going to start with just a few brief words about the history of nursing at the Brigham. Brigham and Women's Hospital has a rich tradition of excellence in nursing. Today, we are fortunate to have 3,600 nurses providing compassionate, expert care to our patients and loved ones, and contributing their talents to research, innovation, and education. Our nurses were recognized among the best in the nation for the highest quality care they deliver with their colleagues through the Magnet designation. During this critical time, we are truly grateful for the support and collaboration of the Massachusetts Nurses Association, which represents our nurses. I'd like to start by asking each leader to say a few words to open. Trish, let's start with you.
Okay, so as Erin said, I'm Trish Powers, and I'd like to say that first I'd like to thank Maddie Pearson, who's the chief nurse and our leader for Brigham Women's Hospital and the nurses. I'm the elected chairperson for the union, and first I'd like to say about my 3,600 nurses that yes, nurses are fearless. We are worried. We're worried about the current conditions in our state, in our hospital, and in our country. But we are so trained, highly trained, and we're lucky to be Brigham and Women's Hospital nurses. We think this is a great opportunity for us to show that both us and the hospital are on the same page, and we are unified to fight this coronavirus, something that none of us could ever have imagined or ever experienced in our lives.
Thank you very much, Trish. Dr. Pearson, would you like to say a few words?
I would. Thank you, Erin. So it is my privilege to be the chief nurse at the Brigham. I love what I do, and I think we have the most remarkable nurses that I've ever worked with in my career. So I agree with Trish wholeheartedly. I also serve as the operations chief for our hospital incident command, which is a group of leaders and experts that come together in situations such as this to really try and address each and every issue as they come forward so that we can keep our patients very safe and our staff very safe and our providers very safe. First and foremost, every decision we make is for our patients and our staff. We keep them in the center. And this includes how we conserve our PPE, which is personal protective equipment. We refer to it as PPE. So what we do is based on other hospitals' experience in the West Coast and around the world. We've learned from what they've done. So conservation, so that we have enough of this protective equipment for our clinicians when they're in a situation with an infected or potentially infected patient, is critical to us. So, Trish identified that we have fearless nurses. We do. Their response to this disaster of sorts and this pandemic that we're seeing through the world is nothing short of extraordinary.
Wonderful. Thank you both for those opening remarks. We have our first question from Priyanka McCluskey from the Boston Globe. She asked, what is the current policy on personal protective equipment, or PPE, as Dr. Pearson mentioned? I just want to state for the media, the hospital does not release policies, but I would ask Dr. Pearson if she's comfortable talking about what is our current strategy as it relates to PPE, because there's been a lot in the news about conservation and concern about supply.
Absolutely. So our strategy really is to conserve this valuable asset for when we need it. Our infection control providers and experts are the ones who really define what level of PPE one wears when caring for what type of patient. And so we're trying to really conserve all of that for the situations where it's really required. We also have other strategies to really reduce the use of this PPE, in that we are trying to limit the number of non-essential staff who walk into the patient's room, again, to limit that and to really control the PPE, as well as we no longer let students during this period of time go in and care for patients during their rotation, again, to try and really protect this valuable asset.
On the PPE, the personal protective equipment, I think there's been a lot known that the nurses at the Brigham, we do have some Facebook pages, and the nurses, being nurses, this is what we do. We like to plan ahead. And as soon as we saw what was going on, especially in Italy and the western part of this country, we have asked for donations on our Facebook pages. We have 3,600 nurses, so needless to say, we have 3,600 family members multiplied out by that, and a lot of people that we encounter, whether it be family relatives and things, we have had quite a few donations of different types of PPE, even N95 masks. What we are doing is basically, we have gotten a lot of stuff. And what we plan on doing is when and if the hospital runs out, that we are then prepared to protect ourselves and our colleagues. We are working collaboratively with the hospital now as we face this oncoming crisis so that we can all be on the same page. I want my nurses to know that the hospital is aware of what we are doing. They have, I understand in this day and age, I'm a person who went to Haiti in the earthquake. We didn't have to worry about lawyers. And hopefully that will happen here too, but that's just the United States of America, right? So yes, we are concerned about our PPE. We have a lot of things that we have collected home. I think the nurses of the Brigham have bought out the Home Depots, the Lowe's, the mom and pop stores throughout the state, and we actually had a Lowe's in New Hampshire who donated all their N95s to us. So we are very organized. We have spreadsheets. We are counting our different materials that we have, whether it be PPE, goggles, wipes even, and we are going to then share those spreadsheets with the hospital, and together we are going to battle this virus.
Thank you so much, Trish. I do want to make clear what the process is at the Brigham. So the MNA, the nurses who have been doing these collections, are creating an inventory of what they've collected that will be reviewed by our safety officer, our infection control people, to make sure that the donations are things that we can actually use and appropriate. A lot of other people have been inspired by what our nurses are doing and have seen it on social media, and we're getting inundated with requests to donate things. So please be looking on our social media pages, be looking on our website. There will be very comprehensive, detailed guidance about what we can and cannot accept in terms of donations. But Trish, thank you so much to you and your team for everything that you've been doing. Follow-up question from Priyanka. Do we have enough PPE to ensure that nurses, and I imagine she means all staff, are safe?
Do you want me to jump in and then both of us?
Go ahead, please.
I think anyone who watches the news these days knows that there's challenges. We're hoping that we're going to have enough, and we don't know how long this is going to go on. If anyone saw the president's press conference yesterday, I hope that his numbers are wrong when he says July or August. We have to trust in our leaders, both in the hospital, the state, and the nation. I think, obviously, Maddie and I are nurses. We don't make these things, but We have to hope that we're going to have enough. I don't know if we will, and I hope and pray that it doesn't come to that, but I think that I would be lying if I had 100% confidence to say that we have enough to last through this process, because honestly, we don't know how long it's going to go. So those are, we have to put our faith in that our government will be able to get us what we need.
So, thank you, Trish. PPE, it's been a challenge. We know that there is a shortage nationwide, worldwide, and so we are like every other healthcare institution in the country. We are putting conservation measures in place. We're very comfortable with them. We are, leaning on really the expertise of our infection control providers to help us really identify in what situations staff and clinicians need to wear what type of PPE. And we're working across the Mass General Brigham system, the partner system, to really be able to coordinate this effort across all of our entities to ensure that we really do have enough for what we need to keep our providers safe.
Thank you, Dr. Pearson. Carrie Goldberg from WBUR is asking the current number of employees who tested positive. The answer to that is 2 and or are on quarantine. So we currently have 93 employees across all role groups of our 24,000 who are furloughed, not quarantined, meaning they're outside of the hospital for 14 days because they potentially had an exposure to a COVID positive person. So I hope that answers Carrie's question. Alexandra Galante from NBC, what special patient/staff precautions are being taken at Brigham and Women's? Do you want to talk about, Dr. Pearson, about our visitor policy?
Absolutely. Other than really training our staff and our providers very, very well as it relates to what we call the donning and the doffing, or the putting on and the taking off of this equipment, and we have observers that really watch them to ensure that they put it on correctly. Again, because safety is first and foremost in our minds. We have implemented a restrictive visitor policy whereby we're restricting the numbers of visitors who come to the organization. We are screening every visitor and every patient upon entrance to the building. We have limited entrance to 3 entrances rather than many. And so we have our staff with their IDs entering certain entrances. We have limited the staff and patients to others. And so if anyone screens positive in any of the risk factors, we're asking them not to visit, which again is a serious move because we're taking the protection of our patients and our staff very seriously. So those are just some examples.
Excellent. I would also add that as of Monday, any employee of the Brigham, as I mentioned, we have 24,000 employees, any of the employee of the Brigham who does not need to be on campus to perform their work duties is working remotely, at least for the next 30 days, which we also think will cut down on the spread and the potential. Kimberly Bookman from Channel 7 is asking, or is saying, the Nurses Association has said that they would like corona cases to be designated to one floor so not to expose others, and that they'd like nurses to volunteer rather than being assigned to coronavirus cases. Are those ideas something you plan to implement?
I can.
Do you want to comment, Trish?
Sure. I'd like to say that, yes, I think that we are on the same page with the hospital with that. As you all know, this is evolving basically minute by minute. I think the hospital agrees, and those plans are being formed to do that. I'd also like to say, because I know the question about nurses and staff being tested, we have had some nurses tested. I'm in contact with them. And I want to say how brave my nurses are, all of them. Whether they're tested at home, they're hoping that they're negative so that they can get back to work. And we have probably more, needless to say, in the oncoming days who will be tested, and probably some who will test positive. But we're here, we're ready, and we already have nurses taking care of patients that are COVID positive. I heard from them today, as did Maddie Pearson, from one of the nurses in charge. And what her message to me is that they're here, they're doing it, they feel confident with the PPE they have right now, but also the training. It's just been amazing. Anyone who knows me as the union leader, you know that 5 years ago we were on the verge of a strike, and we had different leadership here at that time as far as nursing. But it's so I'm just so relieved that I'm sitting here doing this press conference with Maddie, and that all our nurses here can have the confidence that both the union and the hospital are doing everything in our power to not only just protect the patients and the greater community, but the staff as well.
Thank you, Trish. Dr. Pearson, I know you're the operation section chief for the incident commander, and you're involved in a lot of the decisions that are being made. Do you want to address the single designated unit for coronavirus patients and how the surge planning is going?
So we have a phased surge plan in place. I think it is being executed very well. We started small, given the way that kind of the disease is progressing and the numbers of patients that we're seeing. And so our expanded surge plan does entail identifying 2 patient care units and really designating all of the patients to those units for all of the reasons that we identified before. So yes, that's in place, it's moving forward, and we're very comfortable with our plans.
Excellent, thank you. Jason Solowski from Boston 25, how do you plan on handling staffing shortages if nurses test positive for COVID-19? Dr. Pearson?
So we have an unbelievably flexible staff. We have staff who, from a nursing perspective, really rise to the occasion every time. And so we have nurses who right now, let's say, work in a procedural area, but 3 months ago were working in an intensive care unit, are volunteering to really work back in that unit if we need some help from a staffing perspective. We have been, by design, reducing some of our volume, both in the inpatient and the clinic areas, and so we're using some of that staff to redeploy into the hospital where we have inpatients. We have staff who are flexible to be able to float, and so we feel very comfortable with where we are right now, with who we have and being able to deploy. We're also working with our system to be able to really create an expanded labor pool and float pool so that we really can deploy from wherever we need from one place in the system to the other. And that really goes for all employees, not just nursing. So I think we have a lot of tools that we'll be able to use going forward.
Can I jump in on that as well? So I myself are operating room nurse. I do OR trauma. I think we have close to 200 operating room nurses. Because we usually run about 48 operating rooms per day, do about an average 160 surgeries. Needless to say, that has all changed as we have canceled all elective surgeries, so we've come down a lot. So even myself, that's my specialty is OR trauma. There probably still will be OR traumas. We had some today. But we, as nurses, will do whatever we need be. We have nurses who, prior to working in the OR, like Maddie said, worked in ICUs, maybe worked in the ER, different things like that. Myself, I haven't worked on the floors in a long time, but I'm willing to do whatever is needed that's asked of me, because that's the situation we are in. This is unprecedented, right? And so, as nurses, we are stepping up. We even have, I believe, nurses who retired, who have just recently retired, even contacted me and I think contacted the hospital, that if they're needed, they'll come back. So that's what nurses are. We don't run from a fight. We face it head on, and that's what we're going to do.
Wonderful. Question from Simon Rios from BUR. Why are we hearing stories about rationing reusing of masks so early into this outbreak?
So one of the conservation strategies that we're employing in concert with the CDC and our infection control providers is that we can reuse masks in certain situations, and so you can wear a mask for the remainder of your shift as long as it's not soiled or wet, and you kind of keep it in good shape. And so that's another example of how we're really trying to conserve this resource so that we are in this for the long run.
What I'd like to say on that too is that, it would be negligent of us not to conserve at this point. We saw what happened in China, we see what's happened in Italy, we look to see what's in New York and other places, and it just makes sense. We are in, as I said, this is unprecedented. If we know that there's a potential that we possibly could run out at this hospital or the state, whatever it may be, we need to do that. I'd rather wear a mask that maybe is not soiled but still does the job than wear nothing. I'd rather have a reused mask. I mean, I think that's one of the things that we were looking to get donated. We got goggles, you know, kind of like the racquetball or ski things. Those are things that, you know, we can take off, we can clean them, and for reuse. We have to be basically responsible, not just to ourselves, but to everyone. This is something that we have to do. We don't maybe like it. And why are we short? We don't know. That's for others to figure out when this crisis is over, whether it's here in our state, here down in D.C. But you know what? Right now, that's not, our job is not to criticize or knock why we don't have these things, because we're dealing with the reality. And, you know, many of us who are taking care of the patients, I took care of a patient the other day that luckily I found out a couple of days later had tested negative, you know, and I think that, you know, I think we're going to have a lot more. I'm praying, I'm hoping that we don't end up like Italy, but what if we do? So we have to be responsible in that regard.
Very good point, Trish. Anything to add, Dr. Pearson? I think you've got it covered.
Nope, I think you
Okay,
covered
next
it
question
beautifully.
is from David at CVB. How many of the 74,000 PPE sent to Massachusetts from the national stockpile have been delivered to Brigham and Women's? I don't know that either of you would have access.
No.
We will, David, we'll have the media team find out from our central supply people and get back to you. Looks like another question is coming through, but I'm not seeing it yet. We're approaching the top of the hour. Okay, it's here, and it's from Ryan at NBC 10. Do you have a sense of statewide of how many nurses have either been infected or quarantined? That's not something the Brigham might know. Trish, is that anything that you
I
know?
think, you know, MNA might have an idea, but I would think that would probably be DPH.
Yeah.
I do know just from my friends at other institutions, there are a lot of nurses who are home on quarantine, and some are symptomatic and may become positive. I'm in touch with some of our own Brigham nurses who are home. Some are symptomatic, and like I said before, you know, they're waiting and they're taking the proper precautions. If they become sicker, if they needed to come into the hospital, they would. At this point so far, the ones that I'm in contact with, they probably will be getting their test results maybe today or tomorrow. But this is, you know, we're nurses. This is what we do.
Thank you, Trish. Dr. Pearson, did you have something to add to that?
No, I think we are good to go on that.
Okay. And I do want to say that we at the Brigham, and I believe other hospitals across the city and the Commonwealth, have made the decision that the Massachusetts Department of Public Health will be the source of numbers for testing and positives and all of that. So we will not be providing that information today or going forward. Looking to the team to see if we're clear on questions, which is perfect because we're nearing the top of the hour. I would like to give each of our leaders here the opportunity to just say a few closing remarks. Trish, can we start with you?
Sure. What I'd like to say to the people of Boston and the surrounding community, and especially all my superhero nurses, that not just here at the Brigham, but at the rest of the Boston area, is that we're all in this together, not just here at the hospital, but as a community. And I fear that this is going to get much worse. And I think this is a time when we all need to stick together and be kind to each other. And yes, there's things that may ripples in the thing of planning, and maybe some things went wrong. But like I said, that will be, you know, dealt with at another time when this crisis is over. And I just want to tell the people, our patients, that we're going to be here for you. We're going to do our best to take care of you as we are. You know, I'm so lucky to represent the 3,600 nurses here at the Brigham, and I'm just so proud of them, and I'm happy to call myself a Brigham nurse.
So I too can call myself a Brigham nurse as well, and I'm thrilled and proud for that. We know this situation is constantly evolving, and the dedication, the compassion, the care from our nurses and really all of our clinicians and providers at the Brigham is just nothing short of remarkable. And again, I am incredibly grateful to our nurses for giving of their heart and soul to the Brigham and to our patients.
Thank you. Beautifully said, both of you. For members of media, if you're on the line and we don't know it, we can't get the video to you. So if you haven't already, let our media relations team know that you would like access to the video. Please do contact Mark or Elaine or Serena. You know how to get in touch with them, and we'll make sure we get it to you. Thanks so much for joining us today, and stay well, everyone.